Doctors Without Borders is appealing for help to deal with the situation in Sudan. We're joined this afternoon by Aanjalie Roane, Director of Communications from Doctors Without Borders, on the repeal, or the emergency appeal, that is, for Sudan. Aanjalie, appreciate your time this afternoon. What are the specifics of this emergency appeal?
Yeah, thanks so much for having me. Look, Sudan is currently facing a catastrophic humanitarian emergency from what our teams are reporting on the ground. And MSF has rarely asked for earmarked funding for specific emergencies. In response to humanitarian emergencies around the world, we normally request unrestricted gifts from our supporters across Canada, which allow us to respond immediately wherever needs are greatest. But the conflict in Sudan has been an exception. People's medical needs have far outpaced the international community's humanitarian response. And so this crisis fund will really be able to enable us to adapt our operations in an incredibly challenging situation and draw without drawing critical resources away from the other projects that we are operating around the world.
Apologies for the coughing. How much do you need and how quickly, Aanjalie?
Yeah, in Canada, we have a goal to raise 1 million Canadian dollars. This is really to support long-term needs, both immediate and long-term needs for the emergency response in Sudan. We don't have a timeline currently for how long it will take to respond to these needs. Based on our experience as an international humanitarian organization for over 50 years, we predict that this is likely to become a protracted emergency with several medical humanitarian needs over the coming days, weeks, and even months, and are really seeking these resources to be able to respond effectively.
Absolutely. I'm curious about the staff you have on the ground in Sudan, how they're managing, how they're coping with the stress and safety concerns, of course, of effectively delivering medical care in a war zone where really it's out of control.
Yeah, of course. Our staff in Sudan are really reporting, three major challenges in responding to the medical needs in Sudan. Access to healthcare remains a critical challenge. Many people are cut off from medical care at a time when they need it most. And hospitals are experiencing extreme shortages and an intense level of demand. And some staff and health workers are unable to get to the facilities because fighting is too intense, or roads have been damaged in the fighting. Indeed, there has been a shortage in medical supplies. In a video testimony, one of our project coordinators in the Al Fashar region told us that there's no water, no electricity, that there's a lack of fuel. People are being admitted on the floor and in corridors because of the lack of space. So really dealing with some incredibly challenging situation there. MSF has worked in Sudan for a really long time, since 1979, and we remain committed to remaining, while of course ensuring the safety of our staff within the country.
So, Aanjalie, before I let you go, two quick questions. How can people contribute, and also is the federal government helping out at all?
Sure. So we are inviting Canadians to contribute to our Sudan Crisis Fund, which is available. You can visit our website at doctorswithoutborders.ca, and you'll see more information about that. We are a independent organization, and so we really rely on the funding of individual citizens, which enable us to respond where needs are greatest and not be constrained by when federal funding would be available.
Right. Okay. Interesting. Aanjalie Roane is the Director of Communications from Doctors Without Borders, with more on their emergency appeal in Sudan. I appreciate your time this afternoon. Thanks for joining us, and good luck with this.
Thanks for having me.
Okay.